Now moving towards basically types of trauma. We have acute trauma, chronic trauma, then we have primary trauma and secondary trauma. So basically now we'll study one by one. So let's start with Bismillahirrahmanirrahim. Okay. Acute and chronic trauma are basically classified on their basis of onset. We know acute is sudden and chronic is a gradual type. Okay, so let's start it. Acute trauma results from the abrupt occlusal impact. Abrupt occlusal impact means there is a sudden onset of forceful between the upper and the lower arch of teeth, either due to any reason. So here basically an abnormal occlusal impact is produced by biting on a hard object. It gives like an example when you actually basically break the walnut by your mouth. It's very hard, but you do it. Then restorations of prosthesis that also interfere with or either alter the direction of occlusal forces. It changes the direction of occlusal forces on teeth and they may induce acute trauma. When the direction of trauma is when the direction of forces are changed, so they may also induce acute trauma. Now moving signs and symptoms. You may have tooth pain actually, sensitivity to the percussion and increased tooth mobility. Okay, sensitivity percussion means that if you little bit hit the tooth, it will start paining. It will start pain. Okay, increased tooth mobility. It can have also the TMJ pain discomfort. Can you the patient have? If the forces is dissipated by shift, means if you shift the forces by shifting in their position of tooth or by wearing away or correction of restorations, so the injury heals and the symptoms subside. Yes, when you remove that cause, so ultimately that tissue will heal and the symptoms will be subside. Okay. Okay, then sequel of acute trauma. Sequel of acute trauma means the consequence and result of acute trauma. When you does not treat, or when you does not actually uh, improve that injury, that periodontal injury that has been occurred, so it become worsen. The necrosis will occur, and when necrosis is occur, so there will be abscess formation, and the abscess, when there is for a very long time, so there will be symptoms free chronic conditions, means there will be no symptom. Why? Because the tissue is necrosed, which uses it to cause pain. Now this is a chronic condition. Acute trauma also produce cementum tears, means the cementum is tear detached. Chronic trauma, again, it is a gradual changes in occlusion, slowly and slowly. So it produces tooth wear, means atresion, drifting movement. Actually, drifting movement is actually when slowly the tooth is actually moving away from its normal position. Extrusion, means when the teeth come out of the socket partially or completely. With this, you have parafunctional habits like bruxism, clinching, rather than it is a sequel of acute trauma, means it is not a result of acute trauma. They are saying here acute periodontal trauma. Okay, the criteria that determines if an occlusion is traumatic, whether whether so it will produce periodontal injury, not how the teeth occlude. Again the same thing they have said, that occlusion that caused the trauma, we will consider that produces periodontal injury, but not that normal occlusion the people do, so that it will cause the trauma. Okay, trauma from occlusion refers to the tissue injury, again tissue injury, rather than the occlusion. An increase in occlusal forces is not traumatic if the periodontium can accommodate. Okay, primary and secondary. Okay, now in primary, basically when excessive occlusive forces are applied to the teeth with the normal periodontium support, so it is called primary trauma, means the tooth can accommodate that basically. But when these forces are actually exceed from the periodontal tissues capability, or either when there is a periodontium support is reduced, means the periodontium is already compromised by any other disease, so it will be causing a secondary trauma from occlusion. Okay, so we have discussed the primary, secondary, and then we have acute and chronic. In acute, we study there is an abrupt occlusive forces. Due to that, it causes actually trauma. Then the patient will have the tooth pain, wearing off, and basically sensitivity on percussion. Okay, then we have said when you does not treat the acute trauma, so the tissue will necrose and it becomes abscess actually. It also causes the cementum tears. In chronic, when you come across, so we consider that there are we have the tooth wearing, then we have drifting movements actually. With this we have also the extrusion of teeth. Okay, then with this we have also studied the primary, secondary, and also that the primary is due to when normal forces are applied and the tissue can accommodate. But when the tissues cannot accommodate or reduce periodontium, it is known as actually secondary.